Perfect. And this is an audience question, but I think it's important. And sorry if it's a bit too personal, but since COVID-19 started, have you been trying to avoid using the public washroom?
I found it hard to find access, so I've only found one public washroom in my community um, to date, but I've actually, a lot of the times where I need access to a washroom is when I'm on my runs. And so I've talked to my friends and I've like mapped out a route that I have my friends' houses along the way so that I don't have to worry about not finding a washroom in time. So I've definitely had to get a little bit creative.
Yeah, thank goodness for apps like Map My Run and Runkeeper and all of those that where you can map things out. All right, so we have a vote up with that exact question, and hey, so 83% have tried to find ways to avoid using the public washroom. So hopefully this talk with everybody on, and especially Dr. Barrett can address that later as to whether it's safe to use a public washroom and whether we need to be avoiding it. But how do you feel, Emma? How has the GoHere program been affected by the pandemic?
I think from my point of view, it's at a bit of a standstill in PEI. So whenever I went away this year for school in Halifax and just came back when everything started happening. And before I left in September, I felt like the GoHere Washroom Access Program was the best it had ever been in PEI. If you went downtown in Charlottetown, there was a bathroom on every corner. But then since I've been home and lots of businesses and municipality washrooms have been closed, I feel like it's really hard um, to ensure that those businesses, even that are signed on, their washroom might not be open because they're not open. So it's also hard to sign more people on because businesses have been struggling so much economically and they're just trying to open back up now and they're just following all the proper guidelines. And so I don't know how that falls into, can they have their washrooms open to the public or does that change things?
Yeah,
And Leslie, maybe I can kind of turn to you. Like, it's been amazing to hear Emma's experience with everything from being a patient to having the struggles that she's had to actually being such an advocate for this GoHere program. And I just, for you as an investigative journalist who's done so much work in this area, how does her story resonate with what you've seen? The thing I'd be curious for you to comment on is what do you think of programs like the GoHere program too?
It tracks pretty closely with the things that I see in lots of vulnerable populations that I've researched. And pre-COVID and during COVID, there's a lot of problems with access. I think that we have to look at my big hope is that as we move away from COVID and we move out of this, that the lessons that all people who may have had really great access before or reasonably great access before will sort of be reminded of what's happening now, which is the severe curtailment of people's access, and that will make more people join GoHere. It will make more people push their municipal governments for action on public access to toilets, both on-street public bathrooms, which is something I think that I advocate strongly for. I think we need that access because it's truly equitable access. It's everybody goes and everybody uses it. Like, I often liken it to a bench or a street light or a trash can. It's something our basket of municipal taxes pays for, and we expect it because it's something we all need to make use of our cities. I think also the GoHere campaign shows that publicly accessible bathrooms, so-called customer bathrooms, but bathrooms that are privately supported, are really important parts of that grid of public access too. So I think we need to build both of those up, because Emma's experience is, I've heard that story many times about, people who can't always access, and we just saw 47% of people have been denied. So it's a very real thing.
So have people in the audience been denied access to a washroom program, to a washroom that's not part of the GoHere program? All right, let's see the results. So about 50-50 have been denied access to a washroom. Interesting and a bit scary.